Hi, I'm Dr. Van Yee from the Center for Aesthetics and Plastic Surgery. For those of you who haven't seen yet, we are starting our What You Should Know series. The first one was what do you need to know about a facelift, in particular, who's a good candidate. We're going to continue that with the next question, and that is, how's a facelift done? Well, that can be really scary for some people about incisions and recovery time and what are they doing? Am I going to look natural? What about complications? All that can be part of the how is it done question. So we talked about who's a candidate last time. How is it done? Well, this is a surgical procedure. We've all seen advertisements for lunchtime facelift, weekend facelift, Botox facelift, liquid facelift, and all of those are marketing ploys. A facelift, in my description and in most people's description of a facelift, is a surgical procedure. If you can pinch the problem between two fingers, it's not Botox or a filler or a laser, it is a surgical procedure. So if you can pinch tissue where there's laxity, where there's been descent, loss of elasticity, loss of volume, that's not something that is achieved without a surgical procedure, even though it might have the term facelift. So from a surgical point of view, what's a facelift? Well, it's re-elevation of the descended, lax tissues of the lower third of the face, top part of the neck. That can be combined with other things like eyelid surgery or formal neck surgery or fat grafting or lip enhancement, but the facelift itself is this kind of a procedure. That's done by making an incision typically along the hairline, following the natural creases around the ear, and up through the back of the ear and that little sulcus behind the ear. So for all practical purposes, these incisions are almost invisible, and many times they heal so well that your hairstylist wouldn't even know that they're there. You can wear ponytails and comb your hair any way you want to, and these incisions, while they're often a big part of the discussion before surgery, they're almost never part of the discussion after surgery because they just disappear and people just don't see them. The ones that are in the hairline, they're designed so your hair grows right next to it or even right through the incision, so they disappear also. So what are we doing? We're elevating the skin off of a deeper layer of tissue, what's called fascia. It's a thicker layer of tissue that surrounds the musculature of the face. So we're not really tightening the muscles. We're tightening this layer of tissue right before those muscles, elevating the tissue. But it's that tissue, that fascia, that connects to the skin. So as you tighten that tissue, the jowl, the creases here, the neck are elevated into a more youthful, graceful, natural position that accentuates the chin, accentuates the jawline, smooths out the lines right here. By elevating that deeper tissue and moving the skin with that tissue, you can achieve a much more natural and much more powerful and much longer lasting effect with a facelift. This is not just a skin operation. Yeah, you might remove an inch or inch and a half of skin in front of the ear because things shift so much, but the power of the facelift is really what's done underneath the skin. That being said, now that's been tightened up, yes, there's extra skin to trim off, and that's trimmed off along the sideburn, along the ear, sometimes coming up behind the ear to get that more natural but long-lasting effect with the scar that's almost imperceptible because the tension's not on the skin. The tension's on all the structures below the skin. So that, in a nutshell, is how we do a facelift. Any questions? Come in and talk with us.